Hey everyone, Dr. Geyer here. I've heard so many misconceptions and misunderstandings about IVs lately, so I want to answer a few of the frequently asked questions that we get. And actually, we had something this morning that has it fresh in my mind. So, one of the questions people often ask me is, do I have to be a patient to have an IV? And I say, yes, you have to be a patient. Now, this isn't to um, bring in more patients into the clinic or any of those types of things. I want to share something with you that most people don't necessarily understand is that that intravenous medication that goes into your arm is a medication. It's a prescription. And so IV vitamin C bags and electrolyte bags, it doesn't matter what's in that bag, it's a prescription for you. And so that goes directly under your name. I want to screen share so you can see what happens on the other side of this process for physicians, and you can see why it's so important. So this is a vial prescription template. When I'm ordering injectables, what I need to do is fill this out for a compounding pharmacy, and it has your name as the patient, and it has your address and your date of birth and your phone number and your allergies and your diagnosis. I have no idea how walk-in clinics do it, and I'm not commenting on them. I don't know how other clinics and mobile IV places may be doing it, but I can tell you that we are federally required to fill out a prescription, that all of these injectables are prescription, and every injectable is attached to your name as a patient. So that's super important, because that's a question we often get is, I don't understand why I have to be a patient when I can walk into XYZ clinic and they can just see me. Well, you're a patient there. We're legally required. Each of these are prescriptions. It's considered an intravenous medication. And if 3 or more of these are going into a bag, it's actually considered compounding on our part. And that opens up a whole other slew of things that I'm not going to discuss today. Other questions I get a lot. So I had this morning where somebody sent me a mobile IV clinic and said, I don't understand why their high dose vitamin C is, I think it was $175 or $225. I don't even remember what it was. And yours is the price that yours is. So I'm going to stop share for a second here so I can show you this. I brought up this clinic because I really wanted to know what they were charging for. I was like, I don't know. I can't comment on other clinics, but I'm curious. Let me take a look. I do see this quite a bit. People will bring in their prescriptions from other IV clinics and say, I want you to give me exactly this. And I'll say, well, I would really recommend that we do this, this, and this based on you. And often they're much higher levels. So this is they call it their Mega Myers. This is very common, or Mega Immune, or whatever it may be. And says, regardless of your symptoms, vitamin C has 5 doses of vitamin C according to them. Now I love this one. This is a great example because it's a normal saline bag. And as I look through this at a glance, this is actually what I charge for a high dose vitamin C IV. And I can see that there's no potassium in here, so the electrolytes are not balanced. So if you're deficient in your electrolytes or you're potassium deficient, I'm concerned about this bag already. I did hear last week that this bag, there was a clinic that had run similar bag, 2 of them within 15 minutes on someone, which is a terrible idea. That should never be done. The next thing I'm looking at is the vitamin C content. So 5,000 milligrams may sound like a lot, but it's not. So when you take your oral vitamin C, you're probably taking 1,000 or 2,000 orally. So that's 1 gram or 2 grams. This is 5 grams. So high dose vitamin C, for me, is this entire thing. This entire vial would be 25 grams or 25,000 milligrams. So that's what high dose actually means. 5 is not a high dose. They also talk about glutathione in here, and I'm specifically not naming this clinic, but this is super important, is that glutathione needs to be administered separately. So there are safety precautions with this. It should be given separately. I don't know if they are. They may be doing it through the line separately with glutathione mixed with a normal saline or something along those lines, and then they follow up the IV with glutathione. But I do know plenty of clinics that put it directly in the bag with everything else, and that shouldn't be done. I can also see here the amount of glutathione. This is a much lower dose than what I would do to reach any kind of therapeutic value. So we run into this a lot. Top questions are, do I have to be a patient? Yes, because legally you're required to be a patient because it's a prescription in your name, attached to your name, and I actually send off that prescription to a compounding pharmacy, and they send me this fun box. I'll show you, this is the one I use, and it will have your name on the inside. So this has been blacked out for HIPAA reasons, and every injectable in it will have a single nutrient in it. So this is zinc. It has exactly my directions of what I said, how I would administer it. And then there's a patient name that's blacked out there. So it's for you, it's a prescription. You have to be a patient. Keep in mind that you get what you pay for. So if you're walking into some clinic and you think, wow, this is a smoking deal, it's probably not a smoking deal. You get what you pay for. So that's a big, big piece. Also make sure, I had this this conversation with my assistant earlier where we're coordinating with another clinic that's going to administer IVs. And we realized pretty quickly that that IV may not do this as much as I would hope they would. So we talked about something called a G6PD test, which is what we need to be doing. It's a blood test to make sure that you're safe for high dose vitamin C IVs. And so the clinic wasn't familiar with this test, and I assumed either they weren't doing high dose vitamin C or they weren't doing it safely. So if you're going to do high dose vitamin C IVs, make sure you're doing it safely. Make sure you go to somebody who knows how to administer them, that knows that certain nutrients should not be put in the bag with other nutrients, that knows what order they need to be in, and that also acknowledges that you need to be a patient of theirs, and there are risks along with those benefits for any intravenous medication. So I hope this has been helpful. If you have other questions, feel free to direct message us. And if they're general questions, we're happy to answer them. If you want to establish care, we're happy to do that as well. If you're asking us questions about other clinicians, we won't comment on those. You know, that's not really our place. So wishing you a very safe and happy Friday and weekend. Bye.